We've created this short film so that you can see what it will be like when you have your operation at North Bristol NHS Trust. There are two main operating theatre suites within Southmead Hospital: Brunel Operating Theatres and Cotswold Theatres. In the Brunel building, Gate 20 on level 2 and Gate 21 on level 3 are the reception areas that lead to the theatre suites. Our two Cotswold theatres are in the Women's and Children's Quarter. In the week before your surgery, please make sure you read your admission letter carefully to ensure you understand all the instructions. If you can no longer attend or no longer need your surgery, please let the waiting list team know as soon as possible to allow them to offer the slot to another patient. The phone number is on the admission letter. Your pre-operative assessment appointment may have been several months ago. It is really important that you let the pre-op clinic know if you have started any new medicines since then. It is also very important that you let us know if any of your existing medical conditions have gotten significantly worse, or if you develop a new illness around the proposed date of surgery. We particularly want to know if you develop diarrhea or vomiting, a high temperature, if you've been prescribed antibiotics by your GP, or if you have a cut or infection over or near the site of the operation. Knowing about these conditions helps us to know when it's the safest time for your operation to take place. You have pre-ops number on the contact card they gave you. The pre-operative assessment team will have spoken to you and given you written instructions about any medicines you need to stop before surgery, but please remember to take all your other routine medication, as these are important. If your operation is in the morning, please don't eat anything after midnight. If your operation is in the afternoon, have something light for breakfast before 7:30 AM, like toast. Please stay hydrated by drinking plenty of water, squash, or your prescribed carbohydrate drinks until 2 hours before the time you've been asked to attend for your surgery. It's important not to get cold whilst waiting for your operation, so pack a dressing gown or a warm jumper to wear. Please leave your valuables at home, as we can't be responsible for loss or damage. On the morning of your surgery, please make sure you leave enough time to get to the hospital and find somewhere to park to avoid any unnecessary stress. You will check in at theatre reception either at Gate 20 or 21 in the Brunel building or the Cotswold unit. A member of the nursing team will then take you through to the admission area of the theatre suite. In the Brunel building, this area consists of many small medi rooms used for admitting and recovering patients. To keep this busy clinical area clean and to respect the privacy and dignity of other patients that are being recovered from their operations, only one friend or family member will be able to accompany you past reception. We also ask that you do not wander around without speaking to your nurse first. Our nursing team will admit you, take some basic observations such as your temperature and blood pressure, get you changed into a hospital gown, and may fit some pressure stockings on your legs. Once you have been admitted, you may be waiting several hours before going for your operation. We know this can be an anxious time. Please be assured that we try to minimise your wait by staggering admission times, and we will always try and keep you informed of any delays. We recommend bringing some entertainment with you, like a book or a tablet. The nursing staff will keep you hydrated during this wait by offering you a small amount of water each hour. Before going to theatre, you will meet your surgeon and your anaesthetic doctor. The surgeon will talk to you about your operation, answering any questions you might have and ensuring you've signed your consent form. Your anaesthetic doctor will talk to you about your anaesthetic options and pain relief for after your operation. When it's your turn to go to theatre, you can put your clothes and belongings in your bag. This will remain either in a locker or in your admission medi room. One of the theatre staff will walk you round into theatres, or if it's easier for you, they can help you in a wheelchair or a trolley. In theatre, you will be asked to make yourself comfortable on one of the theatre beds. Your anaesthetic doctor and one of the anaesthetic assistants will conduct a safety check with you, where they will ask your full name and date of birth and what operation you're expecting. Next, they will attach our routine monitoring equipment. The anaesthetic doctor will need to insert a cannula or drip in the back of your hands. They can give you some medicines. It will feel just like the sharp scratch you feel when you have blood taken. If your operation is on your arm or leg, your anaesthetist may have discussed injections of local anaesthetic to numb the nerves called regional anaesthetic. Please refer to the nerve blocks and information video for patients film to find out more. If you have agreed with your anaesthetist that you will be asleep for your operation, the anaesthetist will start the anaesthetic by giving you a nice strong painkiller. This starts working really quickly and will make you feel relaxed. Next, they will give you another medicine to gently drift you off to sleep. The anaesthetist will monitor you throughout the whole operation and will ensure you have all the medicines and pain relief you need. When the surgery is finished, the anaesthetic doctor will take you back to recovery, where a specialist nurse will care for you. It may take a little while to feel wide awake after having an anaesthetic, but this is completely normal. Sometimes anaesthetic drugs can make you feel slightly nauseous after surgery. Luckily, there are other medications which the recovery nurses can give you to take this feeling away, so do let them know how you're feeling. You may also wake up with an extra drip in your vein or artery and sometimes a urinary catheter in your bladder. These will have been explained to you before your operation. After your surgery, we follow the principles of an enhanced recovery program. This aims to ensure you are comfortable so that you can cough and deep breathe, thus reducing the chance of you getting a chest infection. We also want you eating and drinking and walking as early as possible to speed up your recovery and minimise complications like DVT and constipation. If you need a planned single night admission following surgery in the Brunel theatres, you may be bedded down in your Medi-room. This is called the Medi-room Short Stay Unit, or MSS. You will have the same care on MSS as if you had been admitted to the ward overnight, but a quicker discharge the next day. If you need to recover in hospital for more than one night, you'll be transferred to one of the surgical wards. Some patients may go to the high dependency or intensive care unit after surgery. For more information on what it's like to be on intensive care, please watch the Staying on Intensive Care film. We hope you have found this film helpful. If you have any further questions, please call us in the preoperative assessment department. Please remember, read your admission letter carefully, let the waiting list team know if you cannot attend, and let pre-op know if your medicines or health change. Get a supply of your usual painkillers at home. Bring a dressing gown or warm jumper, entertainment and a small overnight bag. If your operation is in the morning, stop eating before midnight. If it is in the afternoon, have a light breakfast, tea and toast, before 7:30. Drink clear fluids, prescribed drinks until 2 hours before your admission time, then stop. Review your written instructions about any medicines to stop before surgery, but please take all your other routine medication.